It's not about incarceration, it's about rehabilitation.
I'm Mark Hackle, Macomb County Executive.
Anthony Wickersham, Macomb County Sheriff.
Darren Santini, Lieutenant with the Macomb County Sheriff's Office.
My name is Dr. Don Amboyer. I currently serve as Special Projects Advisor.
Hi, I'm County Commissioner Phil Kraft, and I'm also the board chair of the Macomb County Community Mental Health Board.
Joe Sabatini, Chairman, Macomb County Board of Commissioners.
Cameras are still rolling, sun is still speeding. Ready and action.
Michael Malone, Principal, Partners in Architecture.
Hugh Lester, Architecture Director, Corrections and Secure Psychiatric at STB.
The new central intake and assessment center for the county is in addition to the jail itself. There was a need for it because of space issues and the aging facility that we had and we were working with. Couldn't find a funding source for that. It just didn't happen, didn't come to fruition. And when I became the county executive, there was another push to figure out what do we do with this county jail. We were able to find that there was some funding that was available from the federal level, state level, and county level that could actually help us pay for the jail itself. Being the county executive gave me a tremendous opportunity to move forward with this project along with our board of commissioners and the current sheriff, Tony Wickersham.
This is more than a jail. When you are arrested and you're brought into the jail, you're going to be treated. We're going to have services for you while you're incarcerated. We want to make sure that all of those things are put in place with the outcome of you never ever coming back, trying to reduce the recidivism rate.
This project is the Macomb County Central Intake and Assessment Center. Its role is to assist the county in dealing with folks who have chronic medical conditions, severe mental illness, or substance use disorder issues.
The state of Michigan is facing a mental health crisis and has been for many, many years. The County of Macomb has taken upon themselves to address this need for not only the county itself, but actually to serve as a model for other facilities across the state and possibly the country.
We see a rise within various communities, not just in Macomb County, but throughout the country, of people facing issues dealing with mental health and substance use. And there's not much out there in a way of dealing with those folks if and when they're brought to a facility like a county jail. So we wanted to structure this facility to manage the care of those individuals 24 hours a day, 365 days a year.
The building is designed to support both uniformed staff and clinical staff, as well as members of the public who are visitors and volunteers, administrative staff, and the residents themselves that all are supported by the spaces that we've included in the facility. When you approach a project that has the goals that this project had, you really need to come to a consensus about how you're going to handle things like the color palette, material choices. How do you make it durable? How do you make it vandal resistant while at the same time make it more normative, more home-like instead of jail-like? And that is what we focused on doing as a team. Trauma-informed, what it means is that almost everybody who comes in contact with the justice system has experienced traumatic events, either as a child or as an adult. That results in PTSD, essentially, and people can be triggered by certain things. You know, a door slamming or a large, loud mechanical noise. So we try to design to eliminate those triggers, to make facilities more calming, have better acoustics, and feel more home-like. That's called normative design. And because we do that, we sort of lower the threshold for people's environmental sensitivities and give them more opportunities to be able to interact with others in a setting that's going to contribute to their ultimate outcomes. It's very important for facilities like this to be good civic buildings. And the way you do that is you make a connection to the outside, you make it transparent, you make it when you go into the lobby, it's instantly legible, you know where the staff is, you know who you're going to be talking to, and you feel comfortable, you understand the space and its human scale.
It doesn't look like a jail. It looks like an actual healthcare facility. And that's kind of the look we wanted it to have, so people realize, you know what, we're serious about this, dealing with mental health and substance use.
Together, STV and Partners in Architecture have collaborated quite well on this project, and we've operated as a single entity. We complemented each other along the ways with really clearly defined roles and responsibilities. Partners really offered our local expertise, our relationships with the county, our understanding of the community. STV brought to the table their national expertise, international expertise, really in correctional facilities, really focused on mental health treatment.
Central to our design intent from the start was providing the amenities and support that were necessary for the staff to be able to be in a better place. So having things like a workout space or the courtyard that we designed that will be open to the sky and have lots of plants and be a place for respite for the staff. These weren't extras. These were fundamental.
We have been in the room with my staff, with their staff, and designing different areas. What is the square footage we need? What type of programming? We brought in correctional staff, the individuals that are going to be working in the facility, to get their input, to outline it so they understand what the new facility offers and how the new facility will operate.
They wanted to know what worked for us. They listened to us. They understood what we do here in Macomb County, and I think they designed the Central Intake and Assessment Center with all that in mind. I believe our new facility will help with turnover because it's going to be a little better correctional experience in there. The days will be better for our correctional deputies, better days, along with some of the amenities that we've built into the Central Intake and Assessment Center for our staff. New expanded locker rooms and showers, exercise rooms, a food court with healthy food choices for our staff.
Is really just the new environment in which they're going to work. Better design, a safer facility, not only for them, but the inmates that they're going to be supervising.
In addition, our teams together were really spearheading a direction for converting this entire facility to a direct supervision model. This project is really the first step for the county in achieving that desire. We actually traveled around across the country, multiple facilities, to study successful examples actually that STV had been pioneers in for many, many years.
What I'm looking forward to is honestly a training of my staff. When we actually go out and learn about direct supervision and bringing that back to our staff here and teach them that and how it can help them in their day-to-day work activities. I'm looking forward to kind of that aha moment with our staff where they're going to realize that this is something special and this is something that they'd like to be a part of.
Macomb County Central Intake and Assessment Center unquestionably is going to make a mark on serving the needs of people that have otherwise been overlooked, been neglected in the past. For the first time, we're going to have professional clinicians working in conjunction with professional correctional officers, correctional staff, to deliver programs that were previously not available. We're going to have ability to screen individuals coming into the Central Intake and Assessment Center on a 24/7 basis, and to screen, to determine what their needs are, to begin to diagnose and develop treatment plans for services being rendered within the Central Intake and Assessment Center, as well as preparing them for release back into the community.
In my mind, it's a wraparound service. We're finding the folks that need that mental health assistance, and we're providing those folks with the assistance that they need. And it's about getting folks out of the jail and back into society where they can be productive members of society.
The investment is huge. It's the largest investment we've ever made as a county. $250 million investment into community mental health, public safety, public health. I hope we're looked at as the leader in innovating and solving a problem at hand that everyone's dealing with, not only locally but nationally. And collectively, I think everyone will hopefully look at us and say, they were the leader, this is how they did it, we should follow suit.